Thank you, and welcome to the training session on weekly COVID-19 vaccination data reporting for long-term care facilities. My name is Elizabeth Kalisle, and I work with the Division of Healthcare Quality Promotion at CDC. There are 4 objectives for today's webinar. The first objective is to introduce the value in reporting weekly COVID-19 vaccination data. Next, we'll go over how facilities can use NHSN to track weekly data. We'll review the module changes for September. And at the end of the presentation, we'll review how to report data in detail. So now let's talk about how we can use the COVID-19 vaccination coverage data collected through NHSN. The NHSN modules are designed to ensure that reporting of COVID-19 vaccination percentages are both consistent over time within a single healthcare facility and comparable across facilities. Tracking vaccination coverage on a regular basis is important because coverage can change as new residents begin to stay at the facility and new staff are hired. Accurate reporting of COVID-19 vaccination data can help facilities with their own efforts to track and improve coverage rates. By using NHSN, vaccination data can be made available to authorities at the local and national levels. These agencies can use vaccination data to help identify coverage gaps and issues surrounding vaccine supply. The data can also be combined with data on infection rates to inform infection control policies and recommendations. Now we'll cover the data elements that can be reported each week through the vaccination modules. There is one NHSN module for reporting COVID-19 vaccination coverage data for residents. A second module is used for reporting vaccination coverage for healthcare personnel, which is located under the Healthcare Worker tab. Even though there are 2 separate modules, the data collected for each are quite similar. There are 5 key questions for both weekly modules in NHSN. First, what is the number of current residents or healthcare personnel? Second, what is the number of these individuals who have ever been vaccinated for COVID-19? This number is the cumulative number of vaccinated residents or healthcare personnel. Third, what is the number of these individuals who did not receive vaccination due to another condition, such as medical contraindications? The fourth question asks for the number of individuals who received an initial complete COVID-19 vaccine series and who are eligible to receive an additional dose or booster. The final question, number 5, asks for the number of individuals who have received an additional vaccine dose or booster since August 2021. We will go over the key updates that were implemented for the modules in September. New categories of personnel have been added to the form. Facilities are now required to report on employees, as well as 3 non-employee categories, such as licensed independent practitioners, adult students, trainees, and volunteers, and other contract personnel. A monthly reporting plan will also be created before entering weekly vaccination data into the NHSN long-term care facility component. Question 3.2, offered but declined vaccine, and question 3.3, unknown COVID-19 vaccination status, were previously optional, but now these are required fields. A new rule has also been built into the application. This rule requires all individuals reported in question 1 must be accounted for in question 2 or 3. We realize that these are several changes, so throughout the presentation, we have placed a green star next to the key updates for your reference. The first question on the weekly COVID-19 vaccination form for residents asks for the total number of residents occupying a bed for at least 1 day, at least 24 hours during the week of data collection. Please note that the number includes all residents and not just new residents admitted to the facility that week. For the purposes of data collection, a week begins on a Monday and ends Sunday night. The first question on the weekly COVID-19 data collection form for healthcare personnel asks for facilities to report on how many healthcare personnel were eligible to have worked at the facility for at least 1 day during the week of data collection. Facilities should include healthcare personnel who are regularly scheduled to work inside the facility. Regularly scheduled means that a person is scheduled to work in the facility at least 1 day every week. Working any part of a day is considered as working for 1 day. Facilities should include regular workers even if they are on temporary leave during the week of data collection. And temporary leave is defined as leave less than or equal to 2 weeks in duration, and this includes sick days or vacation days. If temporary leave extends past 2 weeks, then the healthcare worker should not be included in question 1 for the current week of data collection. Please note that data must now be entered for each of the healthcare personnel categories. Also, each individual should be counted only once in question 1. Another change facilities will see on the data entry screen is that totals for all core healthcare personnel and all healthcare personnel will now be auto-calculated by NHSN. All core healthcare personnel is defined as the sum of 3 categories: employees, licensed independent practitioners, and adult students, trainees, and volunteers. All healthcare personnel is defined as the sum of all 4 categories, including other contract personnel. Now we'll go over the specific categories of healthcare personnel. Employees are defined as all persons receiving a direct paycheck from the facility, regardless of clinical responsibility or patient contact. The second category consists of non-employee licensed independent practitioners, specifically physicians, advanced practice nurses, and physician assistants who are affiliated with the healthcare facility, but are not on the facility's payroll, regardless of clinical responsibility or patient contact. This category also includes post-residency fellows. The third required category consists of non-employee adult students, trainees, and volunteers who are aged 18 and over. This is defined as medical, nursing, or other health professional students, interns, medical residents, or volunteers aged 18 or older who are affiliated with the healthcare facility, but are not on the facility's payroll, and again, regardless of clinical responsibility or patient contact. The fourth category consists of non-employee contract personnel. Contract personnel are defined as persons providing care, treatment, or services at the facility through a contract, but who do not fall into any of the other categories. Please note that this includes agency and/or PRN staff who are scheduled to work at the facility at least once a week. So now we'll move on to reviewing question 2 on the form. This is the same question for residents and healthcare personnel. Facilities should report the cumulative number of all individuals each week in question 1 who have ever received COVID-19 vaccines since December of 2020. For instance, 10 individuals may have received dose 1 of the COVID-19 vaccine during the first week of data collection. During the second week of data collection, 5 more individuals received only dose 1 of the COVID-19 vaccine. So for week 1, the facility would report that 10 individuals received dose 1 of the COVID-19 vaccine. For week 2, a facility would report that a total of 15 individuals received dose 1 of the vaccine. Let's go through the steps of reporting vaccination data for question 2. For this question, you will see a drop-down box of the COVID-19 vaccines. Click on the box and select the vaccine for which you would like to report data. At this time, you will see the Pfizer, Moderna, Janssen, and unspecified vaccine options. The second step is to enter the cumulative number of current individuals who have received only 1 dose of the vaccine. The third step is to enter the cumulative number of current individuals who received both dose 1 and dose 2 of the COVID-19 vaccine. Individuals may have received different types of vaccines. So for step 4, if some individuals received another type of vaccine, please return to the box and repeat steps 1 to 3. This slide outlines some key points about question 2. Facilities should include individuals receiving COVID-19 vaccine at the facility or elsewhere, such as a pharmacy. For individuals receiving vaccine elsewhere, they should provide documentation of vaccination. If documentation is not provided, individuals should be included in question 3.3, which is unknown COVID-19 vaccination status. After a facility enters data for question 2, NHSN automatically calculates the number of individuals who have completed their vaccinations and are fully vaccinated. In this slide, you'll see that a total of 64 individuals have completed their COVID-19 vaccine series. This is an example of how to report individuals receiving dose 1 and 2 of the Pfizer COVID-19 vaccine. Last month, 20 healthcare personnel received dose 1 of the vaccine. For this week, 2 of these 20 healthcare personnel received dose 2 of the Pfizer vaccine. The 18 healthcare personnel who have not yet received their second doses would still be reported as receiving only dose 1 of the vaccine. The 2 healthcare personnel who received dose 2 of the vaccine would then be reported as receiving dose 1 and dose 2 of the Pfizer vaccine. Now we will discuss question number 3. The third set of questions is the same for both residents and healthcare personnel. Question 3.1 is required and asks facilities to report the cumulative number of individuals in question 1 who have medical contraindications to the COVID-19 vaccine. Please note that the term exclusion is listed in question 3.1 in the NHSN application. However, this is no longer used, and facilities are encouraged to consult CDC guidelines using the link listed on the slide for the most current information on medical contraindications. Medical contraindications are comprised of having a history of severe allergic reaction to vaccine or components. Questions 3.2 and 3.3 are also the same for residents and healthcare personnel. These questions are now required. Question 3.2 asks for the cumulative number of individuals in question 1 who declined COVID-19 vaccine. For this question, facilities should include individuals who declined a vaccine for philosophical, religious, or other reasons that are not considered medical contraindications as defined in question 3.1. Question 3.3 asks for the cumulative number of individuals in question 1 whose COVID-19 vaccine status is not known. So for example, facilities may include individuals who claim to be vaccinated but do not have documentation for this. When completing data entry, please note that all individuals included in question 1 must be accounted for in questions 2 and 3. If the sum of numbers entered for question 2 and 3 does not equal the total number of individuals entered in question 1, an error message will appear on the screen in the NHSN application. Question 4 is the same for residents and healthcare personnel. Facilities report on the number of individuals in question 2 who are eligible to receive an additional dose or booster of the COVID-19 vaccine. We will now go over a few key terms. Fully vaccinated refers to an individual who has completed an initial vaccine series. An additional dose or booster refers to COVID-19 vaccine received at least 2 weeks or more after completion of an initial vaccine series. Specifically, an additional dose is administered when the immune response following an initial completed vaccine series is likely to be insufficient. A booster dose is administered when the initial sufficient immune response to an initial completed vaccine series is likely to have waned over time. Please note that a booster dose is not yet approved, and the Advisory Committee on Immunization Practices is expected to issue booster dose recommendations based on a thorough review of the scientific evidence. Please refer to the link listed on the slide for guidance to determine individuals eligible to receive additional doses or boosters after receiving an initial complete vaccine series. Individuals should be counted as eligible to receive an additional dose if they received an initial complete 2-dose mRNA COVID-19 vaccine series at the facility or elsewhere since December of 2020, and eligible to receive an additional dose or booster of the COVID-19 vaccine per CDC guidance. When determining individuals who are eligible for an additional dose, facilities are encouraged to do their best. For healthcare personnel, facilities may not have access to the medical information necessary to determine eligibility. In these situations, facilities should report any healthcare personnel who received an additional dose as eligible to receive this dose in question 4. Question 5 asks for facilities to report on the cumulative number of individuals in question 4 who have received an additional dose or booster of the COVID-19 vaccine at this facility or elsewhere since August of 2021. Weekly cumulative data should still be reported for this question. For example, in week 1, 5 individuals received an additional dose or booster of the COVID-19 vaccine. In week 2, 3 more individuals received an additional dose or booster of the vaccine. Therefore, for week 1, facilities should report that 5 individuals received an additional dose or booster. And for week 2, facilities should report that 8 individuals received an additional dose or booster. So now we'll review the steps on how to report data for additional doses of COVID-19 vaccine for question 5. You will see a drop-down box of COVID-19 vaccines. click on the box and select the vaccine for which you would like to report data. Next, you'll enter the cumulative number of residents or healthcare personnel who received an additional dose or booster of the vaccine. Individuals may have received different types of vaccines. So for step 3, if some individuals received other vaccines, return to the drop-down box and please repeat steps 1 and 2. After a facility enters data for question 5, NHSN automatically calculates the number of individuals who have received an additional dose or booster. So now we'll review a few notes about completing questions 4 and 5. A facility may not have individuals who are eligible to receive an additional dose or booster of COVID-19 vaccine. In this case, since questions 4 and 5 are required fields, please enter a 0 for question 4. For question 5, select any manufacturer from the drop-down box and enter 0. If a facility does not have any individuals who received an additional dose or booster of the vaccine, facilities should select any manufacturer from the box and proceed to enter 0 for question 5. Please note that only individuals who have received an additional dose or booster should be reported in question 5. So now we'll review a few scenarios that facilities may encounter during data reporting activities. A facility may not be able to determine if an individual is eligible for an additional dose at this time because they do not know the individual's health status to identify if he or she is moderately to severely immunocompromised. In this case, the individual should not be reported in question 4 or 5. In another example, a facility has a staff member who only received dose 1 of the Moderna vaccine. However, the staff member expressed an interest in receiving an additional dose of the vaccine. In this instance, the facility should not include the staff member in questions 4 and 5, since he or she did not complete an initial COVID-19 vaccine series. In a third example, a facility is not aware or unable to determine whether any staff members currently meet the eligibility criteria for receiving an additional dose or booster of the COVID-19 vaccine. However, 2 staff members have documentation of receiving an additional dose. For this case, the facility should assume these 2 staff members were eligible to have received an additional dose of the vaccine and include the staff members in question 4 and 5. Question 6 consists of required questions on the availability of COVID-19 vaccine for residents and healthcare personnel. First, indicate if your facility is enrolled as a COVID-19 vaccine provider. Please note that only facilities enrolled as vaccine providers can legally store, handle, and administer COVID-19 vaccine in the United States. More information on steps a facility can take to enroll as a COVID-19 vaccination provider is described using the link listed on the slide. If the facility is enrolled as a COVID-19 vaccine provider, indicate if the facility had sufficient vaccine supply to offer all residents and healthcare personnel. If the facility is not enrolled as a COVID-19 vaccine provider, indicate if the facility has made other arrangements for individuals to receive vaccine. So for example, the facility may have a referral system in place for individuals to receive vaccine at a health department or pharmacy. There is also a field in the application where facilities can describe any issues with vaccine supply. COVID-19 vaccination coverage among healthcare personnel is an NHSN measure for endorsement by the National Quality Forum. The measure is defined as the percentage of healthcare personnel who received a complete COVID-19 vaccination series. For example, healthcare personnel who received 2 doses of the Pfizer or Moderna vaccines or 1 dose of Janssen are considered fully vaccinated. Data on additional and booster doses are required in the NHSN application and help to inform public health response. The measure refers to data submitted for employees, licensed independent practitioners, and adult students, trainees, and volunteers. These categories constitute the all-core healthcare personnel field. For more information about CMS reporting requirements, please see the links listed here. Finally, CDC would like to remind facilities to report any adverse events to the Vaccine Adverse Event Reporting System, or VAERS. When completing a VAERS report, please enter the facility's 5-digit NHSN org ID in box 26 of the VAERS form. Serious adverse events include death, life-threatening conditions, or inpatient hospitalization that occur after a vaccination, even if it's not certain that vaccination caused the event. Facilities should also report vaccine administration errors. Please note that other clinically significant adverse events may be outlined in fact sheets for provider emergency use authorization or prescribing information. CDC has created a tables of instructions document that provides definitions for all categories and questions on the data collection form. Facilities should review all instructions before collecting and entering COVID-19 vaccination data into NHSN. This slide reviews a data tracking worksheet that CDC has developed. It is an optional tool in an Excel spreadsheet format that is designed to help with data collection. Facilities can enter vaccination information and select the week of data collection. The worksheet will automatically calculate data that should be reported to NHSN each week. CDC is currently updating these worksheets. Revised versions will be posted on the NHSN website within the next 2 weeks. Now we will briefly talk about some key points about NHSN and the steps you will need to take to report data. First, we will go over some key roles in NHSN. The facility administrator is the person enrolling the facility in NHSN, is the only person who can activate additional components, has add, edit, delete rights to facility data, users, and users access, has authority to nominate or join groups for data sharing, and is the only person who can reassign the role of facility administrator to another user. There can only be one facility administrator per facility. Users have the ability to view, enter, and analyze data, but these rights are determined by the facility administrator. Users may also be given administrative rights. We'll now go over a few main points for new users to NHSN. Once new user information has been saved in NHSN, that user will receive an automated Welcome to NHSN email with instructions to begin the process of becoming a NHSN user. After agreeing to the NHSN rules of behavior, the new user will receive an automated email to register with SAMS. SAMS stands for Secure Access Management Services and provides secure online access to CDC applications. After registering with SAMS, the new user receives instructions to create a SAMS account and complete an identity verification process. During this process, be sure to follow the instructions carefully to prevent a delay in processing documentation. You'll receive confirmation from SAMS once these documents are approved, and a SAMS grid card will be issued to you. Facilities must obtain Level 3 access once Level 1 registration is completed to comply with reporting requirements. Please note that it will take at least 2 to 3 weeks for a new user to access NHSN. Users should be sure to log into NHSN using their SAMS card at least one time each year so that it will remain active. Because the SAMS card is user-specific and not facility-specific, an individual with user access to multiple NHSN facilities through the same email address could enter data into multiple NHSN facilities using the same single SAMS card. More information about the SAMS process can be found using the link on this slide. Each facility must have a Level 3 user to submit or update weekly COVID-19 vaccination data. NHSN strongly encourages all facilities to have at least 2 registered users with Level 3 access. Please review more information about the process using the link on this slide. NHSN highly recommends that if there is a change in the NHSN facility administrator, he or she should transfer that role to another user prior to leaving the facility. If the previously designated NHSN facility administrator has left your facility prior to reassigning that role to another person, you can request reassignment using the facility administrator change request form at the link on the slide. Please do not re-enroll the facility in NHSN. After the NHSN Help Desk completes the reassignment, the newly designated facility administrator will be able to start the NHSN user onboarding process. So now we'll go over the data entry process. Once you're on the NHSN landing page, facilities will need to select the long-term care facility component in the drop-down box. Once you're on the homepage for the long-term care facility component, click on COVID-19 on the left-hand navigation bar. You will then see two options to select from: reporting COVID-19 vaccination for healthcare workers and residents. You will then see a screen in a calendar format for the vaccination summary data. To report weekly COVID-19 vaccination data, please click on the week for which you would like to report data. Before beginning to enter data into NHSN for a particular month, facilities will now need to create a monthly reporting plan. The plan collects data on which modules and months the facility plans to participate. Users should select options to enter data in the weekly COVID-19 vaccination module section of the plan. Please note that Level 3 SAMS access is needed to create the plan. To add the monthly reporting plan, click Reporting Plan and then Add on the left-hand navigation bar. You will need to select the correct month and year from the drop-down menus. Check appropriate boxes next to weekly COVID-19 vaccination module for reporting facility data. You will see two options for reporting healthcare personnel data and resident data. Click on Save after making the appropriate selections. A message stating that the plan has been saved successfully will appear at the top of your screen. Click on Next to proceed to update the plan for another month. Please note that facilities can create multiple plans in advance. Facilities will see yellow boxes on the weekly vaccination calendar indicating COVID-19 vaccination data can be entered for the week. Next, click on the yellow boxes to enter data for healthcare personnel and residents. You will now see the data entry screen for entering weekly COVID-19 vaccination data for residents. Complete the required data fields indicated by red asterisks. The Tab key can be used on a computer keyboard to move through columns. If there are not any residents reported for a field, please enter 0. To enter data for healthcare personnel, click on the COVID-19 Vaccine Healthcare Worker tab. As noted previously, the fields with asterisks are required categories. If there are not any healthcare personnel reported for a required field, please enter 0. After completing data entry, please be sure to click on the Save button at the bottom of the screen. After clicking on the Save button, a message should appear indicating that the data have been saved successfully. Once data have been entered and saved, you will see a green tab for each existing record on the calendar page. Next, click on OK. Once data have been entered and saved in NHSN, you will see a tab for each existing record on the calendar page. To edit weekly data for healthcare personnel, click on the COVID-19 HCW tab. To edit weekly data for residents, click on the COVID-19 Residents tab. This example shows how a facility would edit data that were previously entered for healthcare personnel. To edit data for healthcare personnel, click on the COVID-19 Vaccine HCW tab. You would follow the same process for editing weekly data for residents, except you would click on the COVID-19 Vaccine Residents tab. After editing data, please click on the Save button at the bottom of your screen. To generate data reports, facilities can use the analysis tool. There are resources on the NHSN website that review how to generate these reports. However, please note that the reports are now organized differently into 2 folders. Reports in the COVID-19 vaccination folder include a default variable list with the new healthcare personnel categories, while reports in the pre-10.0 folder contain the older default variable list. So now we will review how to report cumulative COVID-19 vaccination data in more detail. This slide shows you how COVID-19 vaccination may be reported for individuals who are eligible to have worked at a facility for at least 1 day during the week of data collection. In this example, the facility had 50 individuals who were eligible to have worked. 10 of those individuals received their first dose of the Pfizer COVID-19 vaccine, while 5 individuals received dose 1 and 2 of the Pfizer vaccine. This example shows how COVID-19 vaccination of individuals looks during the second week of reporting. 5 more individuals received their first dose of the Pfizer COVID-19 vaccine during this week, So at the end of the second week, the facility reports that a total of 15 individuals received their first dose of the Pfizer COVID-19 vaccine. You would also still report that the 5 individuals who received both dose 1 and 2 of the vaccine for the previous week. This example shows how COVID-19 vaccination of individuals looks during the third week of reporting. 15 individuals received their first vaccine dose in week 2. You would then add 3 individuals who received their first vaccine dose in week 3. This gives you a total of 18. Of the 18 individuals, 10 received their second vaccine dose in week 3. Therefore, you would subtract 10 from 18. So for week 3, the cumulative number of individuals who received their first vaccine dose should be reported as 8. This example also shows how COVID-19 vaccination of individuals receiving their first and second vaccine doses looks during the third week of reporting. 5 individuals received their second dose in week 2. You would then add the 10 individuals who received the second dose in week 3. Therefore, for week 3, the cumulative number of individuals who received the second dose should be reported as 15. The next few slides will outline some resources that may be helpful. The long-term care facility component website contains links to a variety of training materials. Please note that the training slides we're using today are posted on the NHSN website. We'll also post a webinar recording in the coming weeks. If you have any questions about NHSN, please send an email to user support at nhsn@cdc.gov. Please include weekly COVID-19 vaccination in the subject line of your mail. This concludes the presentation. Thank you so much for your time.